All right, I am here in Princeton, West Virginia at the city park that is absolutely adorable. The drive here came from Charlotte, North Carolina through Virginia and into Princeton, West Virginia was absolutely gorgeous. So the Appalachian Mountains here are much different than what we have at home. We have really big mountains. These are just tree filled, smaller, but absolutely gorgeous. But let me give you the view of this city park. There we go. And if you look all the way down here, you would see my kids playing around on the playground. So absolutely adorable city. Again, if you want to follow the family travel stuff, that's a different channel, but you are not here for that. You are here to learn how Medicare works in West Virginia. So let's talk about it. Let's start with the Advantage Plan side of the conversation. 50% of Americans are choosing Medicare Advantage plans. That's called the Advantage Plan penetration rate. Here in West Virginia, it is 51%, so really close to the national average here. So with Medicare Advantage plans, a big number that we look at is called the maximum out-of-pocket. This is your maximum risk in a given year that you would pay. If everything goes wrong, then you hit your maximum out-of-pocket. Anything above this number that's approved is covered 100% by your insurance company. Now, the national average for maximum out-of-pockets is $5,000 for the year. That resets on January 1st, so just know that every year you're kind of having that maximum out-of-pocket to deal with. Here in West Virginia, the average is $6,700. So it's substantially higher than the national average in terms of your average maximum out-of-pockets for Advantage plans here. Again, we're talking about averages, so there are plans that are higher and there are plans that are lower, but in general, you're looking at higher maximum out-of-pockets on the Advantage plans here in West Virginia. The general rule with Advantage plans is that in the larger, more populated cities, the more competition you're going to have from an Advantage plan perspective, meaning more insurance companies are going to be there trying to get your business, which means that the plans are typically stronger. So again, if you're living in more rural areas, your choices are likely to be more limited. If you're living in larger cities here in West Virginia, you're going to have more options. West Virginia follows all of the same national rules when it comes to switching from Advantage to Supplement plans. So let's talk about two important things that are called trial rights. Trial rights refer to your ability to be on an Advantage plan and try it for a certain amount of time and then be able to switch back to original Medicare and a supplement plan without going through medical underwriting. Medical underwriting is the big issue here. What that is that you will have to answer questions, and based on your health, you could see higher than normal premiums, or you could be denied completely for a supplement plan. That's if your health is poor. If your health is good, it's okay. You can go through underwriting and you'll get on the plan. But usually what happens with people who are looking to switch from an Advantage to a supplement plan is because something has gone wrong. Their health is getting worse and they want the additional coverage of a supplement plan, but to get on one is very difficult if your health is poor. But with these two trial rights, the first one is if you go on Medicare at 65 years old, this is at your birthday, your 65th birthday, and you take an Advantage plan, then you have a 12-month window to try it out. And if anytime within those 12 months you want to switch back to original Medicare and a supplement plan, you can without medical underwriting. Again, this is only at your 65th birthday. If you do this after your birthday, let's say you go on Medicare at 67 and you go on an Advantage plan first, you don't have this same trial right. It has to be at your 65th birthday. Now, the second trial right involves you go on Medicare at any age, so it doesn't matter whether you're 65, maybe you go on at 70 years old, as long as the first thing that you pick is a supplement plan, then at any point in the future, if you want to switch off of your supplement plan and onto an Advantage plan, once you make that switch, you have a 12-month window to try out that Advantage plan and switch back to original Medicare and your supplement plan if you don't like the Advantage plan. This only happens once. You can't keep going back and forth and switching with this. This is just if you take a supplement plan first, switch to an Advantage plan, you have that trial right. Outside of that, you're going through medical underwriting unless you have a special election period. And now the most common for that is you're moving. So if you're moving outside of your plan's coverage area, you have a special election period. You could go back to original Medicare and a supplement plan without medical underwriting. Another common special election period is if that Advantage plan, the insurance company offering it, leaves your area. So let's say I go on an Advantage plan and XYZ insurance company decides, you know what, we aren't offering an Advantage plan there anymore, and they remove it, then I would have the opportunity to go back on original Medicare and a supplement plan without a medical underwriting. There are other special election periods, but those are kind of the more common ones. If you're outside of a special election period or you're outside of a trial right, then you're going through medical underwriting to switch from an Advantage plan to a supplement plan. Now let's switch over to the supplement plan side of the conversation, and there are three ways that supplement plans are usually written, and within a certain state, they're usually picking which type in the state and in general. So the first would be community rated. It has nothing to do with your age. A 65-year-old is paying the same as a 105-year-old. It's based on the community rate there. In general, those are the higher starting premiums. So for a 65-year-old, as you age, those premiums will look better, and I'll show you why. The second is issue age. That's kind of a little bit less than community rated in terms of starting. Issue age is based on the age that you are when you first get the supplement plan. So if you first get a supplement plan at 65, your rate is a little bit lower than if you had waited to get Medicare until you're 67. At 67, there's a different rate. Now, the good thing with issue age is that you aren't getting a bump because of your birthday, and I'll talk about that with the next plan. Community rated doesn't matter your age. Issue age is when you get the supplement plan. And then the last one is attained age. Now, attained age is by far the most popular across the country, and it is what is here in West Virginia. Attained age refers to the age that you have attained is going to have an impact on your rate with your supplement plan. So if you go on Medicare at 65, then you're going to get a rate. But as soon as you have your birthday, your 66th birthday, you have attained a new age and you're going to get a little bit of a bump. In addition to that, the insurance companies offer a little bit of a bump every year due to healthcare costs and inflation. Now, this bump applies to issue age and community rated. The bump because of your age does not apply to those two. We sarcastically call it the happy birthday increase. So attained age has 2 increases potentially every year as opposed to 1 on the other plans. So this sounds like a bad thing, but there's actually some good things with attained age plans. They start the lowest. So nationally, if a 65-year-old were to go look for a supplement plan G, the average is $150 per person per month. Here in West Virginia, it's a little bit lower at $140 per person per month. For a supplement plan N, the average is $120 per person per month for a 65-year-old, and then here in West Virginia, it's $110. So you're slightly below the national averages when it comes to the supplement plan rates. In addition to your plans already starting a little bit lower, there are opportunities for discounts that you can find with the insurance companies here in West Virginia. I'll go over 3 of them. So the first one is called a household discount. What that means is that somebody within your household is insured by the same insurance company with a supplement plan. So for example, me and my spouse are on a supplement plan with the same insurance company. That company will offer us both a household discount. Some insurance companies offer a discount for, it's called a wearable discount. So if you're willing to wear a smartwatch, a Fitbit, an iWatch, something that can track your fitness and sync it with that insurance company, they're willing to give you a discount to see that you are active and exercising. The last discount that we'll talk about here is an annual discount. So some insurance companies offer you a break in the price if you're willing to pay it all up front for the year rather than month to month. So these discounts and others are a way to lower those premiums even more, and this is why I'm always encouraging you to use an independent insurance agent to help you with these plans so they can shop between supplement plans, advantage plans, find you those discounts, and find you the plans that are going to be rated well for you. I'm not even saying you have to use us. Use our competition if you want. Just use an independent agent. It will never cost you anything to do so. If you do want our help, I do have partners who are licensed and familiar with the plans here in West Virginia. My email is in the description always, or you can go to theretirementnerds.com and we'd be happy to help. If you're looking to switch from one supplement plan to another, you're following the same national rules here in West Virginia. So if you've watched all of our other videos, they're pretty general and they're usually talking about the national rules. So all of our other videos will apply really well to you here in West Virginia. But for example, if you're on a supplement plan G and your rates are increasing with the insurance company faster than maybe other insurance companies and you want to switch to another plan G, you're going to have to go through that medical underwriting we talked about earlier. Even if you want to switch from a G down to an N, you're still going to have to go through that medical underwriting if you're outside of your normal windows and don't qualify for what's called guaranteed issue. I'm going to wrap up supplement plans talking about those who qualify for Medicare before 65. This is because you are disabled, you're diagnosed with ESRD or end-stage renal disease, or you have ALS, commonly known as Lou Gehrig's disease. So people can get Medicare before 65 if those apply, but across the country, it's very hard in most states for them to find supplement plans that are even A, available, and B, affordable. Here in West Virginia, it isn't the greatest outlook here. You don't really have a lot of options from a supplement plan perspective, and they are incredibly expensive. Now, once you reach 65, you do have a guaranteed issue window where you could pick up any of the supplement plan letters, and you're paying the same rate that any other 65-year-old would. It's kind of a struggle before 65. You're probably, if you don't want to pay those high rates for a supplement plan, looking at an Advantage plan, original Medicare only, or if you're getting insurance through an employer plan, whether that's your own or your spouse's, you're coordinating Medicare there. And then once you reach 65, you can jump on a regular priced supplement plan. Nationally, the penetration rate for supplement plans, so the number of people who are picking a supplement plan is 21%. Here in West Virginia, it is 18%. That is the 12th lowest of all of the states in the country. Now, again, with these numbers, I'm not telling you that you should or shouldn't get a supplement plan or an Advantage plan. All that is just the numbers here in West Virginia of what we're seeing. All right, I like to leave a secret word at the end of all of my videos, just for those of you who've made it this far, to prove that you've done it. It's an accomplishment, and and I get a lot of comments where people are saying that I've missed something and it's in the video, they just didn't make it to that point. So it's kind of a secret between you and me so that I can take your comments a little bit more seriously and know that you've made it here. So here in West Virginia, I have seen some beautiful, amazing scenery. So the keyword for you is for you to tell me what your favorite type of nature is. Is it mountains, ponds, lakes, rivers? Is it the beach, islands, oceans? You let me know in the comments, and that way we'll both know that you made it this far. Thank you for watching. If you haven't subscribed already, please do so. It helps more than you know. We're going to go explore West Virginia a little bit more with the family. And again, I appreciate you making it this far. I'll see you in the next video.